Hey, Healthy Unicorn Mike here. Happy to see you guys again, as I spoke about. So, thanks for tuning into my channel. Hopefully you guys subscribe and like the content, follow below, right? But for this video, I want to talk to you guys about the networks when it comes to health insurance. They say your network is your net worth, right? Jay-Z said that best. He said, your network is your net worth. Well, and when it comes to health insurance, that's exactly the case. Your network is your net worth. So your networks that you're going to deal with when it comes to health insurance, there's 5 different networks. I'm actually going to go over all 5 in this conversation here today. Stay tuned. All 5 are going to get broken down here today. So the best network is actually a PPO. A PPO. What does that stand for? It stands for a Preferred Provider Organization. Well, what does that mean? It means that you can see any doctor, or at least probably 98% of the doctors. It means it travels with you nationwide. And it also means that you're going to get a higher network discount along with a line item benefit. I'll go over that here momentarily. Right? So you have your PPOs, right? Then your next one below that is actually an HMO. And HMO stands for a Health Maintenance Organization. Those options are county specific, and they don't travel with you nationwide. Then you have your EPO. Your EPO is going to be an exclusive provider organization. Exclusive provider organization. In the business, as I said, we like to say that it's so exclusive that none of your doctors are going to take the coverage. That's common with an EPO. Then you have a POS. With the POS, you're done with a point of service, right? And what happens with that is that you have your open access POS, and then you have your regular POS. An open access POS means that you have a PPO level as far as the network is concerned. You can see probably 95% of doctors, but your line item benefit is tremendously diminished into a POS. And then you have your PFFS as well, which is in essence a pay for service type of system. So from the bottom to the top there, PFFS, POS, EPO, HMO, PPO, right? I'm gonna go in that order from bottom to the top, explaining what the difference is from a network discount perspective, right? So if you go with a PFFS, all right, you're gonna get a 0 to 10% network discount. Well, what does that mean? Healthy Unicorn Mike, I've never heard of a network discount before. Talk to me, right? Well, in this video right now, you're going to learn what that is. Hopefully you're tuning in, and hopefully you're subscribing. But a network discount means the amount of money that the insurance is going to take off the bill. Like they get a pre-negotiated rate, it's going to take money off of the bill before you even get the bill. I'll give you an example. So if you have a, apparently there's music going on today, it's a good day. But if you have a $10,000 procedure, $10,000, that's the average cost of a procedure nowadays, right? $10,000. When you get a $10,000 bill, what's going to happen with the PFFS is they're going to give you a 0 to 10% network discount. Let's say it's 10% for the sake of conversation. So they're going to take 10% off the bill. It's $10,000, they're going to take $1,000 off, and then they're going to give you a line item benefit. Line item benefit, let's say it's $1,500 for the sake of conversation for this particular one. That means on a $10,000 bill, if the network that you chose was a PFFS, you're going to pay $7,500 on that bill. Not the best situation, but it's, again, that's what you chose. So if you went with the POS, right, a point of service system, then that's going up to actually 15%, 15 to 20%, right? So let's say it's 20% for the sake of conversation. Same example there. $10,000, they're going to take 20% off the bill. So they take it off $2,000. They give you a line item benefit of, let's say, $1,700, right? So take off $2,000, $8,000, $1,700. Now you're paying $6,300 for that bill that had you had the previous network, you would have paid $7,500 for it, right? Now, mind you, if you had no insurance, you may pay for the entire amount, right? But if you do have insurance, it's going to be based upon the network. So you have your PFFS, you have your POS. The next one up is going to be an EPO, EPO Exclusive Provider Organization. What that one's going to do is, under each network, for the record, it's going to let you see a bit more doctors. The PFFS is going to be the most limited. Your POS is a little bit more limited. A little bit less limited. And then your EPO is a little bit less limited. HMO, and then PPO is the grandest of them all, right? So under the EPO, Now you're getting 20 to 30% in-network discount, right? So they're going to take off, let's say 30%, just for the sake of conversation, they're going to take 30% off the bill, $10,000 procedure. Take off 30%. They're going to take off $3,000. Leaves you with $7,000. You're going to get a line item benefit of, let's say, $1,800, right? Now you're dealing with paying about, $6,000, a little bit under $6,000, $5,800 for the EPO option. Then if you go to the HMO is commonly what you're going to have at your job. It's known as health maintenance organizations. So with the health maintenance organization, they're going to give you a line item benefit, a network discount of 50%. 50% is going to be where it's capped at, so it's going to be 40 to 50. 50% is where it's capped at for the HMO, right? So $10,000 procedure, same example, they're going to take $5,000 off of that bill before you even see anything. And then you're going to get a line item benefit of, let's say, $2,500. So now you're getting $2,500. You're paying $2,500 towards that $10,000 bill. Now you as a consumer, it's like, man, I'm still paying